Yippee-ki-yay. Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to help you find a great primary doctor and or a specialist. Let's say you need to find a specialist in a certain field. We're going to give you the hints to help you do this.
And this is really critical, Bob.
It is.
As you know, because if you don't, especially if you don't see a doctor very often and something comes up and you want to go in, it's hard to get in, hard to get an appointment. And then when you get there and you find out the doctor is not your type of doctor, you're not happy, it's a wasted time.
Well, it can be the difference between life and death.
It could be.
Without a doubt. If you get diagnosed with something serious and you go to the wrong doctor, I mean, their lack of knowledge or lack of ability could kill you. I mean, we know that.
Yeah, it's true.
All right, if you are new to our channel, on that light note, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, please go over to the FB, Facebook, and like us, Bob and Brad, because again, all this week we are giving out those positive vibes.
Free. That's right.
No charge. All right, the first starting point, I'm going to recommend a book. This is called the Patients Playbook. It's by Leslie D. Let me say the right name, Michelson. And I saw this guy speaking on TV, and he made a lot of sense to me.
Sure.
And he covers way beyond what we're going to cover today. In fact, I'm just touching upon a little bit.
Okay.
The area where he talked about finding a good doctor, primary doctor, and also finding a specialist.
Sure.
But he goes into all the other things you should do. Because, I mean, it's serious business when you're trying to take care of your health. I mean, basically what he says is it's going to help you get the best care from a broken system. Because our system in America, to a large extent, is broken.
Yeah, it's a complicated thing.
Mess.
Healthcare. Yeah, as it goes through. Yeah, I mean, you're specialists all over the place. How do you know what to do? What questions do you ask when you go to the doctor? It's complicated.
Yeah, so a lot of this will be geared, some of the stuff we're going to recommend is geared towards just the United States and some over the whole world. So we'll try to distinguish between the two.
Sure.
So, all right, the first thing he says is, what you should do is you should make a list of what's important to you from a doctor. I mean, are you looking for someone that you can get a hold of easy? In that case, you want somebody who has a practice that's well organized, maybe a larger practice.
Sure.
So that you can get a hold of, if not him, his nurse or a PA or
right. One of the
assistants. Practitioner, right. So make that list of what you're looking for, and that'll help you when you're going to step 2, which is you're trying to gather recommendations based on your list. You want to talk to people that maybe know something about the field. Who is a good doctor? So you want to, I'd be surprised if most of you don't know somebody in the medical field or somebody that knows somebody in the medical field.
Right, some relation. Pharmacists too, if you happen to
know. Oh yeah,
those,
pharmacists, exactly.
They work with doctors all the time. They get a lot of feedback both directions.
You can ask doctors what doctor you go to.
Sure.
And I ask, because we have a lot of access to nurses in the facilities that we work at.
Yep.
So when I first was choosing a doctor in town here, I was asking the nurses, and they all kept saying the same name. So I did, basically, I went to step number 3, which is they said, in the book, he says, go and interview them, which I'm like, what doctor has time to be interviewed?
Right, you're going to call up and say, I want an appointment to interview the doctor. I think they're going to say maybe an appointment is what you want.
Yeah, that's right.
That's all we have time for because they're busy.
So I went and did a physical with this doctor, and he was terrible, to be honest with you. Here he was highly recommended because he did, but he got called out of the room like 3-4 times when I was there.
Sure.
I thought there'd be a little professional courtesy. I'm a physical therapist. He knew who I was.
Yeah.
But he wasn't for me. And so, I mean, that part of the process is very important too. You got to have a fit with the patient.
Right. Sometimes it may be a very good doctor, but if your personalities clash, that's a big part of medicine. You just have to feel comfortable with your provider.
Well, I would say one thing, Brad, is be willing to drive a little bit too.
Sure.
Don't just because they're in your hometown or whatever. My mother-in-law and father-in-law, I mean, he's since passed. I mean, they always went to this doctor in their hometown, and he was terrible. He almost killed her. I mean, seriously. I mean, I don't want to go into details, but he almost killed her.
Yeah, we don't want to get into that.
Yeah. Anyway, and the other thing I would say is consider going to a nurse practitioner or a PA, because they have more time. The way things are structured in the United States, anyway, or at least in our area, they have a half an hour to spend with you
Mhm.
versus 15 minutes, which the doctor has.
Right.
And
And if they're running behind, they squeeze that 15 minutes even tighter. So.
And I'm going to ask you a question, Brad. As a
Okay.
physical therapist, how many times have you been called by a doctor to discuss a patient?
Not a lot.
Not a lot.
No.
But I've been called by a PA or a nurse practitioner.
Yeah,
lots of times.
They have more time.
They have more time. They follow up on things.
Sure.
And you give me somebody, they're going to refer you off to somebody if things get serious.
Right.
But I have a nurse practitioner who's just fantastic, and she just delves really deep into my history and does a fantastic job. I just got called by a PA this week, and she talked to me for 15 minutes about a patient.
So it's a physician's assistant.
Oh, yeah, physician's assistant. I should probably say that. So.
Right. There's physician's assistant, nurse practitioners. They're kind of at the same operating level. Yep. Yeah. They work underneath a physician. They get a little more time, and you get one that's knowledgeable. That's been in the field a long time. They know what they're doing oftentimes.
All right, so let's say now we want to find a specialist. So now we're talking about with advanced degree or advanced training in an area.
So, for example, an orthopedic doctor that does knees or hips or shoulders, or you're going to have, like my mother's in gallbladder surgery is what she's looking at right now. So we're looking for someone who's good at that.
Well, we're going to help you.
There you go.
Yeah, we're going to help you. We're going to give you some advice here. So what we're going to start off with, and this is, again, based on the book. He talked about, why don't we show this, Brad, here?
Sure.
Just look at the top one right here first, www.expertscape.com. And what you do is you go there. We got that?
Yeah.
Can we see it? You got that? When you go there, and what happens is you type in what you're looking for. So like, let's say you have a cancer, I would type in that cancer.
Sure.
What your problem is. Just type in your problem.
Yep.
And then it'll start giving you a list of categories, and you can go to those categories. And then it just really lays it out for you. What their opinion is that if a doctor is cutting edge in a certain area, they're going to be trying to share their knowledge.
Sure.
And they're going to be publishing, so they're going to have scientific papers. So all this is doing is it's ranking the doctors by how many scientific papers they have.
Okay.
Now, does that mean it's the best doctor for you? Not by any means. But what you do is a good starting point, because you'd say, okay, I looked up a certain cancer, and there was a lot of doctors at the Mayo Clinic with that. You could contact, first they might not even be seeing patients. They might just be doing research.
Sure.
But you could contact them, and it's not that hard. I mean, you can email them, or you can get a hold of their nurses, and then you can ask them, who would you recommend as a doctor?
Right.
So, if you're looking for the best doctor, this is definitely a great starting up point.
Sure.
I think you do have to look for people who are, had some of the latest publishing on it.
Right.
So,
because they're up to date.
Yeah. All right. The second thing I would try, and that hasn't anything to do with this book, and this is just a United States thing. There's a book called, and we'll have these listed in our favorite books here, Castle Connolly, America's Top Doctors. And it's the 14th edition now. I have used this book many, many times. My daughter gets migraine headaches, and she struggled with it, and it turned out that there was a great doctor right at the Mayo Clinic.
Sure.
And she went there, and it turned out this was the guy that he had treated Oprah and she got right in to see him, and he was fantastic. She said instead of giving her more medicine, he took away medicine.
Oh, really?
And it was just amazing how well she responded.
Sure.
So, and the second case was my brother, who was diagnosed with myasthenia gravis, and we found again a great doctor right at the Mayo Clinic.
Well,
and again, yeah,
we're pretty blessed with a good source.
We're pretty blessed in having a great clinic nearby here. But again, he ended up basically almost curing it in my brother, because he ended up removing something on his thyroid or something. I don't remember
right,
the case
something that unexpected, and it worked.
Right,
he hit the nail on the head.
That's exactly right. And again, the difference, you talk to people who suffer from things for years and years and years,
right,
and they finally find the right doctor, and what a difference it makes.
Yeah.
So that's, to me, a great starting point. They kind of organize it by the problem, and then they go by regions. So it's a little bit difficult, like, what I had to do, because I wanted to find one in the Midwest.
Right.
So you'd have to go into the Midwest, then you have to look at each doctor to see which one was, if you want to get to Minnesota or Wisconsin.
It's a little homework, but
homework, but it's
a lot better than going and be disappointed. So.
Right. So, all right. Anything else, Brad, you want to say?
Not right, caught me off guard there,
All right,
Bob.
sorry about that. Okay, well, thanks everybody for watching.
And good luck finding that provider in healthcare that you deserve.